were tested as quickly as possible. Both tests came back negative. I appreciate the staff at the Department of Health, an agency for healthcare administration, are working around the clock to ensure the elderly population throughout our state stays safe. ACA has issued mandatory regulations regarding any worker involved in a nursing home, assisted living facility, or serving the elderly. And that's not just medical. If you're involved in food preparation, that you're going to have to wear a mask. I think the fear with the one test, the death in Broward, was potentially transmitted by someone who was asymptomatic and who was working on the staff. So I appreciate Secretary Mayhew acting quickly for that. I think the number one priority I've had over the last week is to have more robust testing capability in the state of Florida. We had started doing testing in state on February 22nd. Prior to February 22nd, anyone that was tested, the samples had to be sent to the CDC in Atlanta. That obviously took quite a bit of time. These labs in Miami, Jacksonville, Tampa, since February 22nd, they have tested a total of 1,653. But if you look just a week ago, that is a pretty significant increase than where we were a week ago. And then during the week of March 8th, private laboratories began processing COVID-19 laboratory tests. So Quest, LabCorp, there's other CLIA-certified labs. They do have to report the results because this is a reportable disease. So they do the testing, and then the Department of Health gets the information, the basics. So they have been doing that. Now, obviously, there's going to be a little lag sometimes in the information as we see more of the drive-through testing. When that gets sent to private labs, a lot of times the people, they're going to get a text message, and they'll know certainly before the Department of Health knows what the result was. And then at that point, that's when the investigations would begin. But they have done on the private side 2,050 tests. So if you go back a week, 10 days ago, I think that's probably 3- or 4-fold increase of where we were. I think we need to do way more tests than that. So that was one of the things. As soon as we declared the state of emergency, you had this stuff with the HHS kit. I asked Jared to get as many kits as possible. So we've now distributed 2,500 test kits. So each kit can do a number of tests. I think the total for 2,500 kits is over 600,000 individual tests. But what I've learned on this is just getting a test kit doesn't mean you can just do the test. You got to get other parts. So Department of Health and DEM have distributed 200 negative and 200 positive controls. So that's another component to doing the test. And then we also are working on making sure all the labs have enough reagents to be able to do the test. But probably the biggest supply issue that we're seeing, well, I'd say there's two big supply issues. One relates really specifically to testing. The other relates to everything. For just specific to testing is the swabs to take the sample. We put in an order probably a week and a half ago for 500,000 swabs. We've not gotten that fulfilled yet. We've also asked the federal government. We're in discussions with HHS and asked them to send. If we have enough swabs and we set up the drive-through sites, you can swab people. Some of the state labs and private labs here in Florida could do it, but then the rest can be sent to Quest and LabCorp. So a huge supply of swabs will let us ramp up the number of people that can be tested very, very quickly. So I've told Jared, do whatever you can to get the swabs. Certainly the president, that would be the one thing I would say would be helpful, that and the PPE for the healthcare workers. When you're doing these testing, you got to be in the special equipment, PPE, so that you don't catch the virus. Some of this stuff's not reusable. I mean, you think you got to use a new one every time. And so that stuff is in short supply. So I've been talking with a lot of hospital folks, and that's one of the main supply needs they have. But I think that's probably going to be nationwide. If you look at the last 2-3 weeks, this is probably the biggest rush to get medical supplies in the history of the United States. But we can't have enough PPE right now. So the swabs, the reagents, and the PPE, if we get more of that in, we're putting the infrastructure in place, and hopefully we would be able to greatly expand. And my view is, if you look at the different countries that have faced this, to me, the one that's been most successful is South Korea, because they were able to really do a lot of testing. They did not do draconian controls on their population. They promoted social distancing, but they were able to do the test, do the investigations, isolate the proper people. And if you look in Florida right now, we have about 50% of our cases are Miami-Dade and Broward counties. The rest are kind of spread out here or there. Some counties don't. I think a majority of our counties still don't have any, or close to, don't have any positive tests yet. So you have community spread in Broward and very likely Dade. Obviously, we want to know how many asymptomatic people are carrying that. And so if I have the materials, if we can get that in Florida, we would be able to expand the number of people and the categories of people who would be able to come in and get tested. So that's what we've been working on nonstop. And I've learned a lot about how this works, but hopefully we're getting in the right place on that. The other thing I would say that hospitals have done, most of the hospitals in the state have started to postpone elective surgeries. And I think that is a positive thing for the effort, because the PPE will be preserved, some of the other supplies, and then the hospital space will be preserved as well. And so I anticipate to see more do that, but I've talked to a number of hospital folks over the last couple days, and they're pretty much all moving in that direction. Mobile sites update. So we are, the National Guard is completing the setup of our Broward Memorial Healthcare mobile site today. It's going to have 5 lanes. One will be designated specifically for first responders. We'll have 100 National Guardsmen there supporting the effort. We'll be partnering with FDOT, Florida Highway Patrol, Broward County Parks and Rec, Broward Sheriff's Office, City of Pembroke Pines Police, Quest Diagnostics, Memorial Hospital, and we'll have 11 nurses as well. There's 800 sets of PPE for the Florida National Guard. We have right now about 1,700 collection swabs. Obviously, we want to plus that way up, be able to move more people there. So as we get more swabs, we'll be able to expand this. So our hope is to have this thing finished sometime today. What Memorial is going to do is they are going to have this, when the patients contact, Memorial is going to take the information, identify the symptoms, and then say, okay, you show up at this time. And so we're going to try to make it orderly. We're going to try to make sure that people can kind of get in and out. We don't want people waiting in line for 4 hours. And so we'll hopefully have an announcement about all of that sometime tomorrow, and then look to start it, by the end of the week. But I would just caution people on this. The states that have tried this, many of them have not worked out because I think the expectations were unreasonable. So I just want want people to be measured. We're looking at first responders, looking at healthcare workers, we're looking at seniors 65 and over with symptoms, and then people with underlying conditions that have symptoms. We hope to be able to do a couple hundred a day at least. Memorial has their own lab, so if we can move it through there, you may be able to get the results quicker. As we scale up, some of that's going to have to be done by private labs. You may not be able to get it within 24 hours, but at least people will be able to go in and get tested. So that's, I think, good news. I think they've worked very hard on this, and hopefully we'll be able to really expand this model and be able to test a wider variety of individuals. But I think it is important to note that there's about 17 sites currently in operation or opening soon throughout the state of Florida. I've had a chance to talk to a number of folks who've been involved with it, and they put in a lot of hard work for it. Tallahassee, the Villages, Ocala, Fort Myers, Naples, Miami, Clearwater, St. Pete, Newport Richey. I think there's a couple in Tampa now, Valrico, Haines City, Jacksonville, starting one soon, Stewart, Pensacola. And so these are, I think, great steps in the right direction to be able to expand testing. All of those healthcare providers that are involved in this are having the same challenges with the swabs, the PPE, and the like. And so that really is the key to really being able to explode the testing. IRMA reimbursement. We saw an opportunity to help some of the local communities once we got reports of COVID-19. So Jared shifted auditing focus to those cities and counties that had not met the 50% auditing threshold to receive funds. The result of that work has been that based on those efforts, the Department of Emergency Management will be sending out on a rolling basis over $170 million in IRMA reimbursements to cities, counties, hospital districts that have now crossed the 50% threshold. So they're looking at a lot of costs associated with this response. They're looking at declining tax revenue because of the decline in business activity. And so this is going to be, I think, very helpful for a lot of our local communities. Another thing that I think people Floridians look for is, okay, who do I talk to about this? I mean, is there a number to call? And so the Department of Health does have a number. When we started this, it was open from 8 to 5. And that wasn't obviously acceptable to me, so I had Dr. Rifkes do 24 hours. But I've also asked him to dramatically expand the staff who's fielding these calls, because I think that a lot of people are confused. They want kind of just some answers. And if you can talk to a live person that can put you in the right direction, I think that's reassuring for a lot of people. So I've asked him to dramatically scale that up. And then obviously people are in touch locally with the health departments, and you have a huge expansion of telemedicine going on right before our eyes with what the federal government does with Medicare covering it. And then a lot of the hospitals I've talked to have moved to basically doing free telemedicine, because if they can deal with someone in a telephonic way or on FaceTime, they may be able to say, you have symptoms, you should go to here to get tested, without having those folks present in the hospital. So it's a good use of their resources to do it that way as well. And I'm also directing Ken Lawson at the Department of Economic Opportunity to dramatically expand the call centers at DEO. Monday was the 2.8% unemployment, reflecting really a time that seems a world away. Since this economic change has happened, we've had a huge uptick in calls. Some of it is unemployment compensation, but a lot of it are small business people who are interested in the bridge loans and interested in other ways to be able to get a lifeline. So we want them to be able to talk to someone that can direct them in the right way. So I asked them to do that as soon as possible and hire all the people that will be needed. Our main requests for the federal government are the supplies that I mentioned. I've also joined Mayor Jimenez from Miami-Dade County in asking the federal government to cease travel to and from Cuba. Miami-Dade has a lot of cases. We think a lot of those initially were brought in internationally, but Cuba, we don't know. They're not going to be honest about what they have. They have close relationship with China, so I think that makes sense as well. The final thing I think that we're thinking about is hospital capacity. Mary Mayhew has been working with the Surgeon General, a lot of folks throughout Florida, on identifying ways to be able to expand that capacity if we end up seeing a surge of people. Jared is working on some innovative ideas to be able to deal with that. And I think at the end of the day, you may need, obviously, more beds for people who are critically ill, but you want to have a system in place so that people, run-of-the-mill COVID-19 patients who do not require hospitalization are able to get diagnosed, tested, and then be able to be in self-isolation without that clogging the hospital system. So right now, I think people, their instincts to show up to the hospital, so they're working hard on that, and I think that will make a very big difference. And so where we stand now in terms of our most recent update, 314 total cases in Florida, 80 of those are Broward, 76 are Miami-Dade. We do have 7 fatalities, and we have 1,225 negative test results with 954 pending test results. And there have been over 2,100 people monitored to date. 878 are currently being monitored. So those folks at the health department are working awfully hard. And with that, I'm happy to take some questions.
Manatee County Sheriff Rick Wells, I've been told, is interpreting your order on bars and clubs to allow the clubs and bars to stay open but not serve alcohol after 5 p.m. Was that your intention, and did you discuss that or did that come up with the sheriffs on the call today?
No, so what we're trying to do with this is we want to avoid large crowds throughout the state right now. I don't want to shut every aspect of life down. I think that wouldn't be effective. But I think in those situations, and if I could have figured out a more tailored way to do it, I would have done it. But at the end of the day, you have people crowding into these places, and that is creating the type of activity that we are being warned against. And so if you're one of those establishments, the intent was to suspend for 30 days. And we have our DBPR who holds the licenses, and they're going to be looking to ensure compliance. They are going to put out DBPR is going to put out either today or tomorrow more specific guidance, and I think that they should heed it.
Governor, how can you say that there's no community spread in some of these other communities when you just don't have enough tests to really know for sure?
So I think I've said from the very beginning on all this is what we know is that the people that have presented with symptoms, and the criteria has changed, but as long as they fit the criteria, they've been tested, and we kind of have a sense. We don't have any good sense of who is mildly or asymptomatic and carrying it, not because there's not an ability to test them even, but a lot of it is because they're not going to present for medical attention. If you're 25 years old and you have a mild cough, how many people run to the doctor? It's just not something. Now, maybe because this has gone, ratcheted up a level, maybe you will end up having it. So the only thing I can say is if you have documented cases, then we obviously report those cases. Broward and Dade, from what's been reported and what's been actually identified, those counties are different than the rest. But these things change. And so that's one of the reasons why I think if we could just expand the testing, I think we'd be able to, one, answer a lot of questions, but then two, the strategies that are used to prevent the spread would likely be more targeted and more effective.
Closing the beaches, we're seeing thousands of people.
So you must be relieved that the negatives in Broward County were again negatives, but you still have 4 infections up in Jacksonville. I mean, how concerned are you that we might have clusters that might exist or we don't know exist yet?
Yeah, no, very concerned. I mean, that's why my number one priority is to get all the materials we need to be able to do as much testing as possible. If I had unlimited resources, I would have our health department work with the hospitals, work with our research institutions to do what they call it surveillance, but basically like sentinel screening, where you're trying to get information with people's consent about how this may be under the surface in the community. So that's the number one question: is how many people are carrying it that are asymptomatic. And if I knew the answer to that question, then that would be a very good thing to know.
What do you say to people who are saying that they are symptomatic, they've been to their doctor, they meet every category, but they are saying that they're being refused a test?
Well, so if the doctor says they could be tested, then they can be tested. Health department has capacity to do a certain amount of tests a day or to refer, and then obviously the private lab. So, and that's what will happen with I think these mobile testing sites is that people will go on, and if they're symptomatic and a physician recommends it, then they get it. That's certainly what I'd like to see. And then if we can get enough of the stuff lined up, you can even be more aggressive with it.
Are you pleased with the way the White House has responded to this so far? Obviously, there's a tremendous amount of criticism being pointed at the Trump administration, but just in general, I know we're waiting for swabs now, other supplies.
Yeah, look, I very much appreciate how hard everyone's working up and down the chain, regardless of party. The president's been great to work with. He understands Florida. I need to talk to him sometime today about some of the things I mentioned today. The folks, the VP, everyone's been working very hard. I've enjoyed talking to people like Dr. Fauci. And then I think we have a lot of people at the local level throughout Florida, Republican and Democrat. I mean, we're working most closely with Broward County because they have the biggest outbreak, obviously our biggest Democrat county. But these folks are working around the clock. We obviously are responding with the testing and want to do more. Jared's working on other ways to surge some help down there. So I just view it as a team effort. I view all the different things about, let's hit this person or that person. To me, that's very much like outdated now, and we just got to get through this, get people back on their feet. And so that's going to, and you think about it, I mean, of kind of how much the whole world has changed a little with this. Tom Brady is coming to Tampa. It's like, that's like the biggest news. I mean, I was really pleased. I mean, I've been a Bucs fan my whole life. I think they have a chance to compete for Super Bowl. But it's like, that seems like such a distant thing to grab onto right now because we're in this day-to-day fight. And so let's just keep our eye on the ball. Let's work together and do the best we can for the people of Florida.
In the assisted living facility where the 3 people have tested positive.
Yeah, you want to address that? Is that the Jacksonville one?
Well, I think the one that you confirmed was the one in Fort Lauderdale, but I know
So we had
Jacksonville's-
1 fatality, 1 positive fatality, and then 2 negative. The other fatalities were negative, so that's what we announced today.
Okay, well, can you talk to us about what you're doing with nursing facilities?
Mary, you want to, or both? You want to? Guys, both address.
Christine, you want to just repeat your question for me, please?
I'm just curious what procedures you're taking at the nursing facilities. Are these people getting PPE? You know, I know that's in short supply. Are you testing all the patients? What's going on?
So, first of all, we have sent out increased reinforcement around testing. We want to make sure that any elderly individual that is presenting at the hospital, is in the hospital, that fits the criteria, that they are being tested. We do not want someone in a hospital to be discharged back to a long-term care facility to later be tested positive for COVID. So we are certainly encouraging and strengthening the guidance on testing. We are working with our assisted living facilities and our nursing facilities to make sure that that all their staff, as the governor said, are wearing surgical facial masks to prevent the spread. We are supporting those facilities to be clear about how to submit any orders for supplies. I know that Director Moskowitz is well aware, especially regarding this request for surgical masks. He is focused on how we can get additional supplies of those masks out to these facilities. But we are supporting them in their coordination with their local county emergency management infrastructure so that they're getting their requests in as well.
I guess just as a follow-up, given the fact that you have to have you're elderly or you have an underlying medical condition to be in a nursing home or an ALF, I guess I'm curious, does the state feel like there needs to be testing of all the residents in facilities where people are testing positive?
So there is no doubt, Christine, that for the vast majority, when a call is made by a facility and they are coordinating with their local county health department, there is an immediate effort to support them to ensure that that individual is tested. We are deploying a joint team between my agency and the county health department. They are on site to support the facility to make sure that the individual, that a specimen is collected to test for COVID-19, that they are isolating that individual to care for them appropriately, isolate them from other residents to protect other residents and staff. If hospital transfer is required, that is being supported as well.
There's a report that 19 facilities have known cases of COVID-19 or suspected.
What I have said repeatedly, there are over now 19 facilities where there has been either a suspected case of COVID-19 or a handful to date of confirmed COVID-19 cases. That is just to demonstrate that we are going on site with these joint teams to support those facilities whenever there is a concern about a potential risk for COVID-19.
Do you have enough tests to test every resident in those 19 facilities?
As the governor said, we are working to expand. Director Moskowitz and I have been talking about how best to support that testing.
Not a yes or no.
Lawrence, the governor's got to get on a call shortly. Are there any questions for the
This
governor?
is about the
facilities?
villages, about the villages. Obviously, 51,000 people, most of them are retired. I mean, I think a lot of people are worried about how that's going to work out. I know there's already two tests, one in Lake County, one in Sumter.
Yeah, so that's definitely a concern. Jared is already working on contingency plans for the villages, just given the demographics. I spoke with one of the executives there today, and they've done a lot of change in behavior there. I mean, people are taking it in stride. They're working hard. Great people there, great community. But obviously, just given the demographics, there's extra precautions. We are working on with the University of Florida to do a program in conjunction with the villages to try to expand the circle of testing. We've been working on it for the last several days. Hopefully we'll have an announcement on that soon, but I think that it would be appropriate to do something there. And also I think you're seeing more people start to be tested, and the villages, we're working, envisioning with the Broward thing, people kind of drive up their car, you do it. Villages, they're gonna be driving up in their golf carts, and they're gonna be getting swabbed. They're actually going out and they have all these golf courses. They're still playing golf, but they're social distancing. They're each taking their own cart. They're not being next to other people. They're not touching any of their stuff, and they're kind of rolling with the punches. So I think it's good. You had one more?
Where are the 19 facilities located at, and are you all going to be putting out a list so people will know?
So Mary would have the list of that. I mean, so this would be the 19 that where there's a pending test or there has been a positive test. So yeah.
Because of federal privacy, we cannot release the name of the facilities, but we can share by county the number of facilities, and we will put that out.
Governor, we're getting a lot of calls on the stations we represent asking why you haven't closed daycare centers.
Because I think the parents have they're under tremendous amount of pressure with the schools, and I don't think it's as simple as just saying you close them and everything's going to work out great. I think that'll cause huge issues throughout the state, and I think that is something that first of all, I would be very loath to do on a statewide basis simply because the spread of this has been uneven in various parts of the state. But I think a lot of parents, they're trying to make the best of this, and I'm just very concerned about trying to make it more difficult for them. So I have not had the public health people come to me and say, if you need to do this to protect public health. I think that would be considered more of a prophylactic measure going beyond what I have evidence to do or facts to do. And so we'll say, I mean, with the schools being out, if a parent is a single mom and she's working, and then all of a sudden now the schools are out, it's a very stressful time for a lot of people. So we'll look at everything we can do to be helpful, but that's just not something that has been presented to me as being something that would be necessary at this point. And I also think it would create a huge amount of issues other than that. Thanks.
Thank you, everyone. Thank you, everyone.
Secretary Esper, great guy. A lot of it is the supplies that we discussed. And the great thing about it is, one, he wants to be helpful, but two, I'm not the only governor that said the exact same thing about PPE, about swabs, and about some of these other items. And so I think that message has been received, and I know DOD has some capacity there. HHS, I think, is going to be the one to actually distribute the stuff. But look, they don't trust the states with it. We'll give you a couple of the big hospital systems, send it to them, and let them do more of the testing. But I think he's going to be helpful, and I appreciate it.
Good night from the State of OC Tallahassee. Good night, satellite. Good night, captions.